Hi, I'm Sherry Harlan Davis, program host for Reid Beside You. And today we are joined by our guests, Dr. Naeem Raza and Amanda Gibson and Tanya Ross. And before we get started, all of our guests today are working with Reid Health Gastroenterology, and Tanya actually works with me in business development, and she's our physician liaison. So before we get started, Dr. Naeem, am I pronouncing that right?
Yes, you are.
Okay, I want to make sure. And tell us how you came to Reid Health.
I joined the Reid Health System 2 years ago. I had my initial medicine training at University of Pittsburgh, followed by a gastrointestinal fellowship, and then I was a chief fellow in the same department at Geisinger Medical Center, Pennsylvania. I had an opportunity to be trained in advanced procedures in my specialty, and afterwards we moved to Indiana. And 2 years ago, we found our new home at Richmond with the Reid Hospital.
Great. And Amanda, how did you come to Reid?
I started with Reid Health in 2018. Actually, I did my clinicals with the primary care provider, and I really liked the people and the atmosphere. So I decided to join after when I was finished. So I joined in October 2018.
Great. And Tanya, how did you come to Reid?
Hi, Tanya Ross. I've been with Reid for about 8 years. So I served in a capacity with orthopedics previously, and now I'm in business development.
Oh, great. Well, we're very excited today to have each of you with us. And today we're going to talk about a relatively new procedure that's being done at Reid Health. And that's called an endoscopic ultrasound. So actually, can you tell us how you brought that the endoscopic ultrasound to Reid? Now, you want to get with Dr. Naeem first.
Sure. As I mentioned, I joined the Reid Hospital 2 years ago, and we were in the process to establish this department of gastroenterology in coordination with the Reid Hospital. We provide at this time all gastrointestinal care related services. We perform here clinical services, upper endoscopy, colonoscopy, ERCPs, but at the same time, I showed my interest as I am trained for endoscopic ultrasound, and we found there is a huge need in this area. We also seen that there is the patient find difficulty to travel. It's almost an hour drive for these services. Hospital arranged all the equipments, and we are able to now provide this excellent service to our community and all the patients nearby in the community areas. We started this service in December last year, and so far we are able to perform around 40 plus procedures.
And exactly what does the endoscopic ultrasound do?
Endoscopic ultrasound is an excellent, minimally invasive procedure. It helps us to assess both digestive and the lung diseases. It is basically a special scope which use regular endoscopy where we can see directly everything. Plus, it has a special transducer in it which provides ultrasound waves. And this helps us to have detailed images of the lining of the digestive tract and the chest, and also all the nearby organs, for example, pancreas, liver, lymph nodes. We can now not only see those organs, but also if we need to get any biopsy, we can do that safely during that procedure, where we can pass the needle by directly seeing the needle going through in our images and get the tissue, not only to help diagnose, but we can also provide some therapeutic help to those patients.
And while they're doing that, one of the things are the results are immediate, or the test results are pretty quickly revealed.
So the alternative or traditional methods includes surgery, for example, which is exploratory surgery, where the much aggressive and invasive procedure, and the tissue specimen collected and sent to be checked. Other method is to have the needle going through the skin into the tissues and sent to be checked for results. In our procedures, we bypass all that. There is no pain or discomfort involved, and that person who can look at the results is also available in the room to provide us preliminary results. We can also interpret and inform to the patients what we see in our endoscopy and ultrasound images, that what we are looking at, what stage this condition or disease is. So yes, we can provide a lot of information to the patient and immediate family and the referring physicians.
And I'm going to ask Amanda and Tanya, just jump in when I am still new to learning all of this. And so please, when you'd like to chime in, please do.
I will say that the results that are given, like Dr. Raza said, they're preliminary. So Dr. Raza and I work together, and usually these patients follow up 1 to 2 weeks post procedure. So we really work close together on these EUS procedures and getting the patient their final diagnosis, what the biopsy showed, and their further plan of care that's necessary for them.
Go ahead.
Just ask real quick, Amanda or Dr. Raza, how do you believe this procedure is going to impact patients' lives, from patients that have never received the ultrasound before and now are able to have this service enrichment? How do you think that's impacting lives?
First of all, if it is a diagnostic, it can save their time. First of all, if, for example, most of the abnormal findings we have seen through the routine CT scans, MRIs done for the same reason or other reasons. Also, our oncologist, cancer specialists, and other GI, gastrointestinal colleagues, when they do the procedures, they find some swelling, tumor, mass, or the patient is suffering from abdominal pain from chronic pancreatitis or cancer-related pain issues. So in these situations, we help, first of all, not only to diagnose appropriately in a timely fashion without making this patient to travel to a distant place. And also we can help to immediately stage how far the disease, mass, or tumor has spread, because we can see which layer this mass is starting or originating and how far it is spreading by taking some biopsies from the lymph nodes or nearby tissues where we find the spread. And then we can also provide sometimes pain relief by numbing the nerve ganglia, nerve system close to the cancer mass issues. Sometimes there are cavities or cysts filled with water and fluid in the pancreas from chronic pancreatitis, giving those patients a lot of pain and discomfort, difficulty in tolerating their food. We can drain those cysts and improve their pain symptoms also. So it can improve a lot in their treatment option in combination with our other physicians and colleagues, and also improve their symptoms such as pain and improvement in their intake of the food.
And what's the difference between just endoscopy and then on the EU, or from the high speed?
So endoscopy is a routine, conventional, traditional procedure, is done every day by all the gastrointestinal physicians. It is small, soft tube which has camera and light. So they can see inside the gastrointestinal tract or lumen. But the ultrasound is an additional capability transducer built in the same scope, which produces sound waves like the regular ultrasound patients do routinely as an outpatient. So we can see what is inside the gastrointestinal lumen, and also we can see what is in the layers of the walls of the gastrointestinal area and the nearby organs. Those things we can see only by this additional support by this ultrasound scope inside the routine scope.
And how is that procedure performed? Is that outpatient, inpatient?
Yes, these procedures are outpatient. First of all, we receive the request by the referring physicians, and our office schedules those procedures. Amanda will go through this detail. Once those procedures are selected, scheduled, we bring those patients in our outpatient surgery center. We discuss those patients prior to the procedure, what our goals, objectives, risks, and benefits. We also have help with anesthesiologist physician. So all the procedures we do here in the Reid Hospital are done while the patient is in sleep. They breathe by themselves, by their own, but they are very comfortable and sleepy during these procedures. These procedures are done in the same position like the other routine procedures, but these patients generally take around 45 minutes to an hour comparing to the 30 minutes in the other routine procedures. After the procedure is completed, we able to discuss those findings, the results with the patients and family. They are able to go back home, resume their regular medications and the diet and lifestyle.
So it's a quick trip.
Yes.
And I know we talked about some of the indications and usefulness about the procedure.
Yes. Basically, most common reasons we get as an indication is about cancer or the mass. Routine CT scans, MRIs are already diagnosed by finding of mass in the lungs, in the chest, in the abdominal areas, such as in the stomach, pancreas, liver. This procedure decreases again by other methods. It is much more exhausting to go by surgery to make a diagnosis, and we do it by almost routine endoscopy with this help of the ultrasound probe inside to make a diagnosis what this tumor is, how far it has already spread, what are the treatment options like that. Other conditions where we can help, if there are stones from the bile duct, which is a small tube coming from the liver and the gallbladder, we can find those stones and help those patients to get the stones out of those bile ducts to improve their symptoms. This procedure also help if there are cysts or cavities in the pancreas where they're suffering from abdominal pain, so we can decrease their symptoms. Again, we can also inject numbing medicines in those chronic pancreatitis or pancreatic cancer patients to improve their quality of life and the symptoms in those patients.
The if the person was coming to have the procedure, what's the prep would be involved?
I would ask Amanda to join here for the pre-op screening in our office and instructions to those patients.
So the referrals are sent through either Epic or faxed in to the Reid Gastroenterology. And then we have clinical staff that goes through to see the urgency of these referrals. And then clinical staff will discuss with Dr. Raza, how soon that this EUS needs to be done. So pre-op would be pretty similar, just like an EGD. So they would be NPO, so nothing to eat or drink after midnight. And then they would start a clear liquid diet at supper time the night before to make sure that their stomach is cleared out so they don't have any food in their stomach. And then depending on the patient, if they have a cardiac history or if they're on blood thinners or a diabetic and they're on insulin, then we would consult with their physician to get orders the okay to hold their blood thinners, or their dosing of their insulin would be different since they're NPO, nothing to eat or drink after midnight.
And what description of the tools that you would use, or?
So during the procedure, it is basically the same endoscopy, although slightly larger in the size because it has ultrasound probe in it. Otherwise, it is almost the same. Even the complication risks in these procedures are almost the same, which we are seeing in the traditional or conventional procedure. So that is an excellent news that risks on these procedures are extremely low to happen. And the patients do not have any pain or discomfort in these procedures. We do discuss with the patients the risks of infection, risks of perforation. Those risks are the same standard, extremely low to happen prior to the consent in these patients. Some patients do require, prior to the procedure, intravenous antibiotic if we have a pancreatic cyst to drain and in certain other conditions. And after the procedures, we ask them to watch for abdominal pain and other complications.
And post-procedure care, and Amanda or Dr. Naeem?
That would be, so post-procedure would be Dr. Raza would go out and talk to the family and discuss what was found during the procedure. And then, like I said, but prior, we get a preliminary report on if a biopsy is taken during the time of the EUS. But then Dr. Raza and I and the other nurse practitioner, we work close together and we get these patients in, get their results with them, within a week. That's our goal. And then what the next step is for them.
And looking at like the biopsy, we discussed that. The other parts of just the diagnosis and the palliative care, do you want to highlight any of?
Yes. So again, it really helps us to diagnose not only what is the condition or the disease in these patients and saves a lot of time. It also helps us to stage how far the disease or condition has spread. Many times the treatments are different from surgical to medical treatments based on the diagnosis and based on the spread. So this procedure can help us in this at a very fast speed in this regard. Palliative cares, yes, again, we can help in some patients to improve their pain symptoms, which is quite important to improve their quality of life. In some patients, we can drain the cyst to improve their symptoms of not only intake of food and pain both. In other patients, sometimes we can inject certain radio-opaque markers right in the center of the mass or tumor. And that helps our radiation oncologist, cancer specialist, to target that tissue safely so they can decrease the damage to other surrounding normal tissues.
What would you like people to know that we haven't discussed? Just things like not being afraid that this is really, I'm just more excited about that the lack of that people don't have to travel. This procedure is actually available here locally.
Yes, this procedure is helpful in many conditions. This procedure is available at their own local Reid hospital. Again, the safety associated with this procedure is excellent because it is the same, very low comparing to all other standard routine GI procedures we are doing it in our practice and any other standard care practice in other places. And we do routinely upper endoscopy and colonoscopies procedures across the centers and other places like that. So which considered is extremely low risk, safe, and very valuable procedures.
And would you like to add something, Amanda?
I mean, Dr. Raza covered it all.
Like you, ma'am.
Well, it sounds like a lot of what I'm learning is a lot of this is an offset from, you work a lot with oncology.
Yes, we work with oncology. We also noticed because of a lot of CT scans, MRIs are done now these days as routine care in the emergency rooms or other facilities. And there are many incidental findings. So our radiologists, colleagues, emergency room physicians, and also our other biggest referral is from our own gastrointestinal colleagues. When they are taking care of those patients, are doing the procedures and finding some tumor mass swelling in the lumen, and they need our help. So we are getting referrals from all other places also.
Also, you had mentioned about more with gallstones and with seeing, so I can imagine, I hear a lot of people that have lots of challenges with gallstones in our area. And so with this, you use this tool for this procedure actually, and looking at gallstones?
Yes, this procedure in regard to the gallstones is a mainly diagnostic procedure. Sometimes our patients have certain metals in their body, defibrillators, pacemakers. They cannot get routine X-rays, MRIs because of those reasons. Our endoscopic ultrasound helps our surgical colleagues, surgeons, to find the nature of the gallstone, evaluate the gallbladder, and if the stone is out of the gallbladder into the bile duct small tube, and that can be sometimes very painful condition for our patients. They can also get infection due to the stone blocking the tube. Making it an accurate diagnosis with the help of endoscopic ultrasound helps us to choose ERCP, which is an advanced endoscopy, to remove that stone blocking from the tube, and having that person arrange safely, appropriately, in a timely fashion, their gallbladder surgery or other medical care.
Was there anything you would like to add, Tanya?
I would just encourage any patients in our regional area, if they have any questions or any interest in the procedure, to speak to their physicians about it. And also feel free to reach out to the gastro office to ask how they can get this procedure so they can get more information a lot quicker and close to home.
Great. Well, that's one of the things that we like to educate the community, that maybe a person might be struggling, but they didn't have the transportation, they couldn't go somewhere else, and that we can share that we offer this procedure here locally. So that's just a huge benefit. And I know that we have a slide. We're going to explain where people can contact your office. And I'm trying to make sure I have your information. They can contact the gastroenterology office, and making sure if they want to make an appointment. And I believe that's at 765-935-8923. And we want to thank Dr. Naeem Raza, Amanda Gibson, and Tanya Ross for joining us on this episode of Reid Beside You.
Thank you, Sharon.
Thank you very much.
You're welcome.
Having us.